The story of a doctor, a mystery and a discovery that changed medical history. I want to tell you about a doctor, and to protect her privacy, let's call her Dr. Maya. Not because of what he said to her, but because of what his body was hiding. She almost missed it, and if she had, we might never find it at all. His name doesn't matter. What matters most is what he brought in with him. Fever, severe pelvic pain, and a confession he clearly didn't want to make. He'd been with someone new, someone outside his relationship, a few days earlier. He was scared and he was ashamed, and he was far in more trouble than he knew. When patients come in carrying guilt along with their symptoms, they need two things from you. They need you to not judge them, and they need you to not miss anything. I made him a promise out loud. Right there in that room, I said, whatever it is, we're going to find it, and we're going to fix it. And I meant it. I had no idea what I was promising. She found a chancre, painless ulcer, signature of primary syphilis. She ordered the blood panel immediately. HIV screening included. She already suspected. 12 years of emergency medicine had taught her to trust that feeling. Suspecting something and seeing it written on a lab report are two very different things. His result came back positive for syphilis and for acute HIV, both at the same time. I've delivered hard news before and I've held hands. I've cried in break rooms after shifts, but something about that night, the rain and the empty waiting room, the look on his face, it stayed with me, even after he left. Here's what most people don't know about ER doctor. You do your job perfectly, you make the diagnosis, you give the right treatment, and then they walk out that door and you have absolutely no control over what happens next. None, zero. You just have to trust them. She administered a high dose of intramuscular injection of benzodazine, penicillin G, on the spot. She gave him a 6-day course of oral antibiotics for the secondary infection. And she arranged a follow-up appointment herself. Not just a referral slip, a scheduled slot. She looked him in the eye and said, "This is not optional, you have to come back, and you need to promise me." I thought about him after that shift, probably more than I should have. I checked the system 2 weeks later, no follow-up, no visit. I checked again at 6 weeks, nothing. At 3 months, I put a note on his file, a flag, just in case. I told myself he was fine. I told myself the penicillin maybe had worked. I needed to believe that. 18 months passed, 540 days of silence, and then, on an ordinary Tuesday night, he came back. I recognized his face barely. His hair was falling out in patches. His eyes, I don't know how to describe it. His eyes looked like someone who had been lost for a very long time. I didn't ask how he was doing, I just said, "I've got you and let's go." The symptoms were catastrophic. Hair loss in irregular patches, shooting nerve pain running up both legs, severe abdominal pain he'd been enduring for months, and stomach ulcers he hadn't mentioned to anyone. And then, the symptoms that made Dr. Reyes grip her pen a little tighter. He told me he'd been losing his vision for about 4 months. 4 months, and he thought it might get better on its own. I excused myself and walked up to the hallway. I stood there for about 30 seconds and I took a breath. Then I went back in because that's the job. The untreated HIV had destroyed his immune system completely, with no defenses left. The syphilis had gone everywhere. His eyes, his nervous system, his stomach, his colon, and every biopsy came back the same. Syphilis. Dr. Reyes had never seen anything like it, and she had been doing this for 12 years. She ordered one more test, a full genomic sequence of bacteria from his stomach tissue. She wasn't sure what she was looking for. She just knew something was wrong. Not just medically wrong. Something she couldn't name yet. The lab director said, "Maya, I need you to look at these sequences." That's when I knew it. It wasn't a normal call. She doesn't use my first name. The genomic results showed 2 completely distinct strains of syphilis bacteria in his body. 2 separate infections, acquired at the same time from the same exposure. Each one had been mutating rapidly inside him, evolving, diversifying with no immune system to stop them. But that was not the discovery. The discovery was what the two strains had done to each other. There were sequences in that data that should not have existed. Sequences you cannot inherit, sequences you cannot acquire from a single infection. Sequences that could only exist if two separate bacteria had combined, had literally exchanged DNA with each other inside them and made something new. It's called intra-host recombination. Scientists had suspected bacteria could do this for decades, but no one had ever caught it happening in real time, inside a real person with full genomic proof, until Dr. Reyes ordered that one extra test, until she trusted that unnamed feeling that something was not right. In doing so, she had her colleagues documented the first new hybrid strain of syphilis ever recorded in a living human being. I cried. I'm not going to pretend I didn't, not because it was scary, though it was. I cried because I kept thinking about all the patients like him, all the people who walked out of emergency rooms and never came back. And I thought, what else have we been missing? What else is evolving right now in someone we do not know because they were afraid to return? After the paper was published, I started getting emails from researchers around the world, from doctors who had similar cases and had never connected the dots, from patients who recognized themselves in the description. I wasn't expecting that last group. They humbled me completely. The patient survived after months of aggressive treatment, IV antibiotics, antiretroviral therapy, and the kind of close monitoring that comes from a doctor who wasn't willing to lose him twice. He recovered. His vision partially returned, and he came to her office one afternoon unannounced. He didn't say much. He didn't need to. He just showed up. This time, he kept the appointment. When he walked in that day, I thought about the night he first came in, the rain, the empty waiting room, the promise I made. I thought about the 18 months I spent hoping I'd been wrong to worry. And I thought, this is why you don't give up on a patient. Not when they disappear. Not when they stop calling back. Not even when they make it really, really hard, because sometimes, not always, but sometimes they find their way back to you. Dr. Reyes now advocates for extended follow-up protocols in co-infection cases. She speaks at medical schools about what she calls the follow-up gap, the space between a patient leaving a clinic and a patient coming back, a space where, if we're not careful, something new can grow. Dr. Reyes said, I didn't get into medicine to make discoveries. I got into medicine because I wanted people to be okay. This case taught me that those two things are not as different as I thought. Sometimes the most important scientific breakthrough in your career starts with just staying in the room, asking one more question, ordering one more test, and absolutely refusing to stop caring about someone just because they made it hard. But here's the part that stays with me. It's not the diagnosis, not the discovery, not even the fact that something new, something had never been seen before, was growing inside him. It's this: he almost didn't come back, and if he hadn't, this entire story, everything we just talked about, wouldn't exist. No discovery, no warning, and no second chance, just silence. So the next time someone walks out of a hospital room, the next time someone ignores a symptom or decides they'll just deal with it later, ask yourself, how many stories end right there without anyone ever knowing what was really happening? And how many discoveries are we losing because someone was too afraid to come back? If you made it this far, you already know this isn't just a story. So subscribe, because the next one might even be harder to forget.